Hello, my name is Stephanie Guzman. I hope you're doing well today. We're going to take good care of you. I'm here to explain the mole surgery you will have today to remove the basal cell carcinoma. As you may or may not already know, basal cell carcinoma are abnormal, uncontrolled growths in the epidermis, which is the outermost layer of the skin. It is usually caused by any combination of exposure to UV radiation to the sun. According to the Skincare Foundation, Mohs surgery is the most effective technique for treating common skin cancers, such as basal cell carcinomas. So, for the Mohs surgery, we'll draw some marks around the area of concern, inject the area with local anesthesia. A dermatologist, who's a surgeon, will remove a very thin layer of skin with a scalpel. A nurse will bandage the area up. You'll wait in the waiting room, and we will send the tissue to be tested in our in-house laboratory. Our technician will process the specimen by freezing it and thinly cut it into sections and place them on slides. The tissue is stained and examined under a microscope to see if there are any remaining cancer cells. If there is any remaining cancer cells, you will be called back into the operating room. They will numb the area again, remove the layer of tissue where there has been any remaining cancer cells. Then they will repeat the process with sending the tissue to the lab to confirm all the cancer cells are gone. If all is clear, depending on the size of the incision made, the surgeon may close the wound with stitches or leave it open to heal and just bandage it. The area will be most likely bandaged, and they will provide you with instructions on the aftercare of your incision. The purpose and goal of the surgery is to remove all the cancer cells. This can take time, typically several hours, time well spent because the Mohs surgery has a 98% cure rate. Although the Mohs surgery technique conserves the greatest amount of healthiest skin possible, unfortunately, there may be some scarring. This depends on the wounds and incision made that would determine if reconstruction with a neighboring skin or skin graft is needed. The surgeon may repair the area with another specialist if need be, such as a plastic surgeon. It is very important to follow the instructions given to you to minimize infection. Following the surgery, we will schedule you an appointment within 2 to 4 weeks for the stitches to be removed and evaluate the surgical wound. If no other questions, let's get started. Thank you.